afternoon, everyone, and thank you for joining us today for our webinar on planning for retirement. We have a great brief presentation for you today to give you some of the ins and outs that you need to think about when considering retirement, some of the main and key concepts that you need to go through in order to be successful with your retirement, to ensure that it is a smooth transition. And so let's go ahead and get started. If you do have any questions, please do write them down. I will provide my contact details at the very end, and you'll be able to email me or give me a call and be happy to set up a time to speak with you or meet with you in person to further discuss some of your particular situations and what Cirrus can do to help you make this transition as smooth as possible. And this presentation will be recorded, so if you do have to run out early, or one of your colleagues wants a copy of it, it will be available, and all of our presentations are listed on our website as well. So let's go ahead and get started. So a little bit about Cirrus, because we do have several new members, new clients here today. So we were founded back in 1994, headquartered in Toronto. We have two major components to the business. One is lease negotiations, which we do several hundred per year, helping doctors, dentists across North America, making sure that their lease is for basically proper. A lot of physicians we find and dentists don't necessarily take the time to look and negotiate. They sort of just get whatever the landlord is giving, and they think it's great, and that's it. So keeping in mind, especially with retirement, the lease is a very important factor. So that's definitely something that we can help with. And then the Cirrus Healthcare Consulting Team, which I'm part of, and we provide billing and operational support, both to groups and individual physicians. So we help ensure that your practice is running smoothly, that your practice is running efficiently, and that you're getting paid for the care that you're delivering. And we do offer many seminars and webinars on this topic. So any questions you do have regarding that, please don't hesitate to reach out and ask questions. So the purpose of today's program is to get you guys thinking. Are you planning to retire within 1 to 3 years? And what do you need to know about that? So as I said earlier, there's a lot of key components to ensuring a smooth transition into retirement. And we're going to hopefully touch on a few key ones that are on most of your minds, or should be at least, when you're considering retirement. And we'll go through one by one and see what we can give you guys. So some of the first steps in thinking about retirement are, am I going to retire cold turkey, that's it, or am I going to stay on part-time? So that's, one of the first questions you want to ask yourself is that, am I going to slow down on a part-time basis? Do I want to take the last 6 months, let's say, bring in a locum or bring in a potential buyer to my practice, work together for a couple months? I'll work 2 days a week, he'll work 2 days a week, something like that. Or do I want to just say, January 1st, I'm done, goodbye, give your patients a couple months notice, bring in a new physician, and that's it. So that's really one of the first questions you want to ask yourself. And that ties into, obviously, choosing a retirement date. Do I want it to be in 3 months, 6 months, a year from now, 2 years, 3 years, however long you want it to be? Coming up with that date is essential, and sticking to it, of course, is very important as well. Now, we'll touch on this later, but from the ministry standpoint and just from good practice, giving your patients at least 3 months notice is required and or advisable. Giving them enough time to decide, do I want to find a new physician? Do I want to stay with a potential physician that's coming in to take over? All those are key components. Informing your staff. So now, do they have a formal contract with you, a formal employment contract? That is definitely something that is extremely important. Figuring out on your end, what are you responsible for? So are you responsible for any severance liability pay? So how much time do you need to give your staff? What type of payout do you need to give them, if any? From that perspective, it's definitely important to speak to your lawyer to make sure that if you have drafted a contract, find out exactly what it states. If you don't have a contract, again, find out what that means for you. What are you responsible for? What are you obligated to provide to your staff? And if a new physician is taking over, speak to your staff about that and ask them if they want to stay. They could have been working with you for 10 years, 20 years, 30 years, or fewer, and maybe they don't want to stay at all. You're retiring, they want to move on to something else, or maybe they want to retire as well. And speak to them and let them know that potentially they have the option to stay with the new physician that's coming in. But again, it's up to them, and perhaps the new physician doesn't even want them to stay. So, all those aspects, regarding staffing, discuss it with them first, find out what their thoughts and desires are, and then, of course, with the incoming physician, speak to them and find out if they're even interested in having your staff stay. I would say in most cases they do. Obviously, if you've had a staff there for a number of years, they're comfortable running the office, they're comfortable with the patient population, the patients are comfortable with them. So, trying to reduce the changeover obviously is a benefit to the new physician coming in, and they'll have an easier time transitioning with the patients. So again, speak to your staff, speak to the incoming physician potentially, and see what they want to do. And then you can take it from there. But of course, with regards to the employment law, speak to a lawyer, of course, and make sure that your bases are covered. So if you're in a group practice as opposed to a solo practice, what does your governance agreement say? How much time do you need to give them? We've seen in some cases, only minimal time required, let's say 6 weeks, 8 weeks. But again, we've also seen 3 months, 6 months, maybe even a year in some cases that the group needs in order to figure out what they need to do. If you're all in one location, again, a little bit different than if you're in a faux practice that's spread over several locations. Cost-sharing responsibility. So how is your office set up if you have multiple partners within it? Who's paying for what? What type of, are you guys incorporated as a group? Are you individually incorporated? What does your lease say? In a lot of situations, if let's say there's 4 of you on the lease and one is retiring, you do have to give notice to the landlord saying that you are going to be leaving. Figuring out how you're going to transfer the lease either to the remaining 3 physicians or to now put the 4th physician on, so you take your responsibility out of the lease, so there's no personal liability there or any liability to your incorporation either. So all those aspects, again, we have a dedicated leasing team in-house that is here to help with that matter. It can be very complicated in determining who's responsible, who's not responsible, what needs to be done. So it's very important to look at that right away and take a look to see who's on the lease, who's not on the lease, what responsibilities has the landlord requested by you. So again, making sure that the group is set up appropriately so you're not leaving them stranded or leaving them with any extra responsibility that they may not want to incur. Are you going to be selling your practice? Are you selling your roster? So if you have, maybe some newer physicians coming in to the group and maybe they want to take over, maybe they want to buy your, quote-unquote roster of patients, speak to them. Find out. It could be an easier way to go than trying to find someone else to come in and take over your practice or to sell your practice to. And as I said, bringing in an associate to help wind down. If you're able to find someone, I would say for the last 6 months or so to come in maybe once, twice a week, or as you progress closer to retirement, a few more days per week. Just again, so they have an easier opportunity to re-roster all those patients after you leave, and giving the patients an opportunity to get comfortable with the incoming physician while still being able to see you if necessary. If you're in a solo practice, so again, a little bit different obviously than if you're in a group. You're the only one that has to worry about it. Are you advertising? Where are you advertising that you're retiring? From 2 ways. One, obviously having to let the patients know, but also from the the advertising of selling a practice. Newspapers, local journals, things like that. Speaking to colleagues, maybe in the hospital even, putting up a bulletin if you're close enough. Again, bringing in your associate, obviously, or if you're just going to quit and walk away, then that's fine as well. You don't have to worry about coming in, but of course letting your patients know ahead of time so they do have the opportunity to seek a new physician in the area or whatever. You obviously can send them to some of the colleagues that you've worked with over the years, some friends or other families that are family physicians in the area. So you'll obviously be able to guide them hopefully in the right direction to keep their care going as long as possible. And of course your lease agreement with your landlord. If you're in a solo practice, obviously sort of basing your retirement around the end of a lease, obviously it's better, but at the same time, things come up and you might not be able to do that at the appropriate time. So again, reach out to us, let us take a look at your lease and see what type of obligations you have, what needs to be done to make sure you do have an easy transition with minimal complications or minimal liability left behind. So Medicine Professional Corporation. So if you guys are incorporated, obviously if you're going to still be working a little bit, you want to convert to an ordinary corporation or close it completely. Of course, consulting a lawyer is obviously your best option here just to see what needs to be done. And again, back to the lease agreement, if you guys have your lease agreement within your corporation, which I hope most of you do, figuring out, again, what needs to be done, transferring that agreement out of your corporation into a personal, and then obviously closing out the lease from your corporation. So again, all those components are very important to think about right from the beginning. Almost as important as giving your patients notice and making sure that your patients are being taken care of. So again, let us know what we can help with, and we're happy to do so. So some of the financial implications, obviously, if you have a bank account that's associated with your office, obviously you want to let the bank know that it's either going to be closing down or you're going to be transferring it from the business to a personal. Stop any payments, obviously, from your day of retirement. If you have any outstanding payments, obviously let your credit cards know, things like that. Let your vendors know that you're not going to be working anymore so they don't keep sending you things, things like that. Again, letting everyone know that you're going to be retiring is the best option because you don't want to leave any stones unturned to say, oh, I forgot about A, B, or C, and now all of a sudden I have a bill for $5,000 because I forgot to cancel in the appropriate time or what have you. So always important to speak to the financial institutions, financial advisors as well, of course, to make sure that everything is lined up appropriately. From an insurance standpoint, again, if you're not going to be practicing anymore, obviously you need to re-examine what you need. Look at your policy, speak to your advisors to say, I'm not going to be practicing medicine anymore. I don't necessarily need the coverage that I once had. You don't want to overbuy. You don't want to underbuy. So you want to speak to a professional and make sure that you get yourself the proper coverage moving forward. So as I said, patient notification. The longer you can give them notice, the better. You don't want to scare them off too soon, obviously. That's why it's roughly 6 months, maybe even up to a year that you want to, if you can, give your patients notice. Having your staff give them a call, sending letters, putting posters up in the office, maybe some email blasts if you're a little bit more technologically inclined, and you're excuse me, and you're able to get the email addresses of your patients. Again, as much information as you can give them as far in advance as you can is obviously preferable, but you just want to make sure that your patients are well taken care of. And we know that from dealing with so many physicians, patient care is your primary focus, and we want to make sure that they are taken care of, that they know if somebody's coming in to take over and who they are, get a chance to know them. Or if nobody's coming in, then obviously give them a chance to find somebody else while still being able to access your time. So patient records and EMR. So obviously, based on the college, you are required to keep records for a minimum of 10 years. So keeping either electronically or if you still have paper, obviously then you're going to need maybe a storage unit for a little while afterwards. and giving the opportunity to your patients to call and request that their, again, files be transferred if they're going to see a new physician now, or giving the opportunity for the new physician coming in to take over those records and access all the information needed for their patient base or for their incoming patient base. From an EMR standpoint, obviously cancel the contract if you're going to be, stopping or transfer a contract to a new physician coming in. And of course, you obviously want to maintain confidentiality. So anything that's on your computers obviously has to be wiped professionally and properly, making sure that there's nothing left behind. Of course, just throwing something into your recycle bin doesn't get rid of it from your computer. There is always going to be something there. But if it's done properly and professionally, then obviously we're taking care of that confidentiality and getting everything wiped appropriately. So here's a little bit of a graph of what needs to be done. So again, we've spoken about walking away or having a new physician come in. So there's two different avenues, obviously. So if you have a new physician on the left side there, obviously you're going to transfer your roster. Maybe you're selling it to them as well. You're going to transfer a lease agreement, or the landlord is going to create a new lease agreement. Or if you're in a group and a new physician is joining, obviously they need to be added to the lease agreement as well. So obviously you need to speak with all your colleagues. Everyone has to get together to figure out what the best solution is. Staff transition, as I said, making sure that you're letting your staff know that they have the option if they'd like, or if the incoming physician would like to have them stay. And if you're walking away, obviously you have to give notice, to the landlord, speak to them about your security deposit, any rent that's outstanding, returning any property, liability, of course. So speak to your lawyer with regards to your lease agreement, or speak to us about your lease agreement, any financial obligations that you have, any outstanding debt that's in the business name potentially. How does that factor in? What are you supposed to do with it? Are you transferring it to yourself personally? Are you going to keep it in your corporation? And what have you. So again, speaking to a financial advisor, speaking to the bank, speaking to the lawyer is definitely very important. So who requires notification? So all the medical associations and organizations obviously are listed here. Anyone from the Ministry of Health all the way down to the CMA, to CMPA. Everyone needs to know everyone important needs to know that you're retiring. Of course, if you're going to be continuing to work, let's say in a hospital or on a locum basis, we do have a lot of physicians that leave a FO, but then come back as a locum. They want to work in the after hours. They want to help, the group, whatever it is. Again, you need to let them know what you're going to be doing. So some of the services that we offer, again, roster transfers, roster reconciliations. The longer in advance you can do this, the better off you are. We like to say if you can plan up to a year in advance of retirement, we can help you optimize your practice in that time period to make sure that you're getting the most out of it, that you can earn as much as you can based on the care that you're delivering up in that last year. If you're going to be selling your practice to somebody, obviously we want to make it as valuable and as lucrative as possible for them, making sure that that transition happens as smoothly as possible. We provide that service on an ongoing basis. Having an add-on application for a new physician, again, are they joining a FO, are they joining a FIG, are they just taking over a solo practice as fee-for-service? Whatever the case is, we're going to help you make sure that all those steps are taken appropriately. And as I said, optimize your practice. Ensure all your bonuses and premiums are being tracked properly, making sure that you can show the incoming physician that you receive, X number of bonuses, X number of dollars on a monthly basis, and they understand that by paying $50,000, $100,000, or $200,000, however much it is for your practice, that this is why it's worth that much. This is what they can expect to earn in the first 6 months, year, 2 years, 5 years, and so on. We help, in all aspects of practice optimization. Educating your staff, patients, potential incoming physicians. Again, as I said, posters, letters, phone messages, e-blasts, as much information as possible going out to your patients is extremely important, making sure that they have the time. As I said, a physician's main priority is patient care, and the continuity of care. So let's make sure that we give them as much notice as possible. Group planning. So again, if you're within a group, not necessarily within just a FO, but if you have several physicians in your office, or if you're practicing on your own but part of a group, so you have your own office but down the street from some of the other members of your group, you need to speak to them and figure out what needs to be done. So if you have a FO of 5 physicians and now you're dropping down one, the group needs to know that some of their funding might be cut. What do they want to do? Do they want to try and find someone to bring into the practice? Maybe they have someone that's interested, excuse me, and they want to be involved in that. Or maybe they say, you know what, you take care of it, you're leaving, it's your responsibility to help us find someone, and then we'll vote and meet the person to make sure that we're happy with them joining our group. So whatever it is, obviously if you're within a group, it's very important to speak to them. Look at your governance agreement, what's required timing-wise, again, leasing-wise, very important. And practice valuations. Now we are able to provide you guys with a valuation of your practice. So we look at all aspects of what the potential physician coming in would be taking over, anything from the lease to the practice to the itemized things that are in the office, all your cotton swabs and furniture and everything like that. So we look at everything to help provide you with an outlook of what your practice is worth, and then obviously to provide to the incoming potential buyer of why the practice is worth, like I said, 50, 100, 200, whatever it is that you want to try and get out of it. So again, from start to finish, we are here to help you guys from your lease to your practice optimization to dealing with your group to dealing with the incoming physicians to helping you determine what needs to be told to your patients. All aspects of retirement, all aspects of your practice, we are here to help. So some of the key takeaways for today, of course, transitioning your practice into retirement can be a difficult one. There's a lot of moving pieces. There's a lot of things to consider. There's a lot of things to think about. We're here to help. We're going to help you take care of it from start to finish, every step of the way, to make sure that this transition happens as smoothly as possible. Your roster is one of the most important aspects of your practice, especially in the FO. If you're selling a faux practice, obviously with the restrictions that the ministry has put on these days, a faux practice is worth a lot more now, and a lot of people are trying to get into it. Obviously in underserviced areas there's no issue, but in overserviced, which most physicians want to work, it's a lot harder. So there is value there in selling your practice, and of course having the practice and roster optimized is very important. Setting a reasonable value. Again, let us do a practice valuation for you, giving you a good sense of what it's worth, so then you can then take it to a buyer and say, look, this is why my practice is worth what it is, and this is why I think you should be paying me X number of dollars. Again, walking away, we want to make sure that everything is taken care of, all the loose ends, all the, making sure you're speaking to your lawyer, making sure your financial advisor and the landlord and what have you. We want to make sure that it happens as quickly and as easily as possible. So we're here to help every step of the way. So that brings us to the end of our presentation for today. So I thank you for taking the time to join me, and I hope I've given you a little bit of an insight and first step in thinking about retirement. And as I've said, all along, it's not something that can be just thought of overnight and done the next day. There's a lot of little pieces that need to fall into place leading up to retirement. So please reach out. My contact details are there. If you do have any questions, I'm happy to set up a phone call or meeting with you, or you can email me your question, and I'd be happy to get back to you. But at the end of the day, we're here to help ensure a smooth transition, a seamless transition, and as quickly as possible with as little disruption as possible. So again, thank you very much for your time today, and I hope everyone has a great afternoon, and I look forward to speaking with all of you very soon. Thank you.